Hello friends, it's Kai and Steph again. By popular demand, we will present you the new Meningeal Release video for Koren Specific Technique doctors, since the old video unfortunately got lost. First of all, what we're going to do with this technique is trying to release a tension in the meningeal system. Just for a quick review, the meninges go around the brain, cover the brain, and actually even cover the eyes. Then they go down the spinal cord, kind of like a bungee cord surrounding the spinal nerves, and they are kind of attached to the foramen magnum, a little to C1, C2, C5, and then there's actually no attachment running all the way down the spine, and then the main attachment of the meninges is via the filum terminale right down here at the coccyx. So the filum terminale attaches the meninges to the coccyx at about the level of the first and the second segment of the coccyx. So this is actually the point where we can directly access the meninges. What causes the stress and the detorsion of the meninges? Of course, the main reason is subluxation. It's bad posture over a long time, it's accidents, and all those things can kind of put tension on the meninges, kind of like a neurological pattern that holds the meninges in different positions. And since the meninges have a big influence on the posture and on the position of the spine, and of course on the nerves, this can really cause many different problems. So releasing the meninges along with addressing the subluxations is a very powerful thing. So the place where we will access the meninges to release them is right down here at the junction between the sacrum and the coccyx. So as I said, it attaches to the first and the second segment of the coccyx. So this is where we can access the whole meningeal system and do the release to the meninges. The way we check is basically the classic KST way of checking. We have 6 different positions where the meninges can have tension, adverse tension. The first one is the anterior meninges can be stuck or can be in a tension pattern. To check for the anterior meninges, we let the patient flex the head fully. So just put the chin all the way down and back up. Then we check with the occipital drop, if we are KST doctors, if we get a drop or if we get no drop. If we get a drop, then it means the anterior meninges are in trouble and have tension. Why is it the anterior meninges when we move the head forward? It's because the meninges actually get stretched over the vertebral bodies. That's why the anterior meninges get under tension when you flex the head. This is actually the most important position where people have meningeal stress and meningeal tension, which is logical because people sit in front of computer screens all the time, use smartphones all the time. So everything that moves the head forward puts a lot of pressure on the meningeal system. This is what happens most frequently. So actually everything that you do in daily living that pushes your head forward or lets you look down for a long time is a big problem. Because actually just tilting the head forward just a little already puts pressure on the meninges. This is something that Dr. Breig, famous neurosurgeon, found out by doing a lot of scientific research on fresh cadavers. He found out that just slight flexion of the head already causes a lot of tension on the meningeal system, while slight extension, not full extension, relaxes the meninges. So you should always advise your patients when they work in front of a computer screen, they should tilt the head down, not just the slightest bit. So the computer screen should actually be in front so that their eyes are in the middle of the screen. Okay, flexion forward, anterior meninges. The next check is to have the patient put the head in maximum extension. Just look up all the way and back. And this is the check for the posterior meninges. So again, you do your occipital drop, and if there's a drop, there's tension in the posterior meninges. The next thing is just turn the head all the way to the right. This checks for torque, kind of torquing action in the meninges. You do your occipital drop, then to the left, checking for torque on the left side, and straight. The next thing is the lateral meninges. So you have the patient move the right ear to the right shoulder, stretching the left lateral meninges, and back. You look if you get a drop, and then the other ear, and straight. So this is basically the 6 positions. We have flexion, extension, torque to one side, torque to the other side, side bending to one side, lateral meninges, and to the other side. 6 different positions. So you have the patient move through those positions, you do your check with your occipital drop, and if you find a positive, you release that. So the release for the classic technique is done with the ultrastem. Actually, I'm not going to do just one video, I'm going to give you a little extra. There's going to be 3 videos today. First of all, this is the classic KST way that I developed a few years ago and that some of you folks know. And I used the ultrastem instrument for the release. In the next video, I'm going to show you the advanced version that I'm doing right now that has little things that are a little bit different, but that's going to be the next video. For the release, let's pretend that Steph had the anterior meninges in tension. So she was flexing the head forward and back, and we got an occipital drop. I'm faking it now, but we got a drop. So we know the anterior meninges are under stress. What you will do now is have the patient move the head into the position of stress. So this would be flexion forward. Now there's one difference that is important and wasn't in the original video for the anterior meninges. For all the other positions, extension, torque, side bending, you use the maximum movement. For the anterior meninges, you don't want to have the patient flex the head the full way while you release it. That just puts too much pressure on the system. So you just want to have 70% of flexion. So for the release, we have to flex the head the full way first, and then get back just a little bit and hold here. Now we locate the junction between the sacrum and the coccyx. We go down to approximately the second segment of the coccyx. We put the instrument on an angle. Be careful, we don't want to adjust the coccyx anteriorly. We want to slide up the filum terminalis. So this is a tissue release. So we take the ball, we locate the segment, we tap while we slide up. And then we let the patient move the head back straight. And as we always do, we recheck. Put the head in full flexion again, back up, and if there's no drop, release it. For all the other positions, let's say she got a positive on torque, rotation, right rotation, you would do the release on the full movement. So if she moved the head right, and if we got a positive here, we would have her move the head right again, hold, relaxed, in a relaxed way. Full motion, but no tension really. So the patient moves the head as far as it can go without tensing the muscles up. And then again, locate the second segment, slide up while you tap. And then just do the movement again, head right, and recheck. So this is the classic KST way of checking. I'm just going to show all the movements again, just in a second. Important, I would recommend now, from all my experience, that you do this in the end of the treatment session, not in the beginning. First of all, clear the subluxations, and then the last thing you do is take care of the meninges. And if you combine it with the technique that I show you later, the brainstem release, it's very, very powerful. So again, all the checks. You would first ask, is there meningeal tension in the system? If you get a yes, put the head in full flexion. And you check. Extension all the way. And check. rotate, check, rotate the other way, check, head to this shoulder, check, and head to the other shoulder, check. And if you find something, you just release it. So that's the classic technique, and the next video will be the advanced version. Thanks a lot.